Now, one of the things that Sarah mentioned is that I have an interest in male infertility. It's a pretty orphan, a pretty niche area, not a lot of people doing a lot of work in it. And it's quite surprising that nearly half of all couples are affected by male factors, and yet there really is nothing I can prescribe, nor that we can add to sperm, to improve or treat those couples. And so they end up going down the route of IVF and so on. So one of the things that I'm particularly interested in looking at is diet and environmental impact on guys and what it does to their sperm parameters. So as I said before, obesity has some sort of link with sperm parameters. The more obese you get, the worse your sperm motility and morphology gets, but it's not a very obvious and linked depression as your BMI goes up. Looking at your diet though, one of the things that sperm do is they synthesize nitric oxide. Now, nitric oxide is synthesized by the sperm in response to a number of stimuli, particularly environmental toxins or other drugs, or being unwell or being stressed, smoking and so on. But to a small degree, what happens with nitric oxide is that it stimulates probably production of cyclic GMP and maybe cyclic AMP, so the energy sources within a sperm. So a small amount of nitric oxide synthesis is a good thing, makes sperm swim better, improves your sperm parameters. But what happens at some point, there's a tipping point where too much of a good thing is not a good thing anymore. And what happens is that the nitric oxide starts to generate free radicals and reactive oxygen species, which cause oxidative stress. So that's quite a hot topic at the moment in andrology, is oxidative stress and what we can do to try and surmount that and treat it. And so one of the things that we know that happens when you've got all these free radicals is it starts to attack the membrane of the sperm. It affects the way that the sperm can swim, and it diminishes its ability to fertilize an egg and so on. But it also causes inadvertent damage to the sperm DNA itself, which has obviously an impact on the embryo that it might create. So one of the things I'm particularly interested in is looking at antioxidants and to see, well, what can we do in terms of supplementing a guy's nutrition with antioxidants and so on to see if we can improve their sperm motility, to improve their sperm quality as a means of trying to treat infertility. And there's an absolute plethora of studies out there looking at, for example, zinc, L-carnitine, vitamin E, vitamin C, beta-carotene, selenium, all of these things in small studies looking at a sort of one effect versus not having that exposure to that antioxidant, all leads to the same message. At the end of the day, if you take antioxidants, you can improve your sperm motility. In fact, they even did a study looking at healthy guys, non-smokers, healthy guys, normal sperm parameters, gave them a group of antioxidants containing zinc, vitamin C, vitamin E, beta-carotene and folate, and they even found that they could improve their sperm numbers and their motility. So this is not even in a patient population. So it's quite exciting. And there's a number of compounds that have come onto the market, kind of pro-fertility male vitamin packages. Vitamin is one. Another one is called Proxeed. So these are things that are out there. But the slightly worrying thing from my point of view as a clinician is that we've got these studies looking at single elements, and now we've got these drug companies packaging together groups of elements and selling vitamins at 30, 40 quid a month supply without really having the data behind them. So at the end of the day, there was a big Cochrane review which was published in 2011, looking at all of these different antioxidants, and the conclusion really became, well, we're not really clear what we should be doing or what we should be, we know that antioxidants are good, but quite who, why, how many, and so on is yet to be established. So another study that came out last year that kind of caught my attention was looking at supplementing guys with 75 grams of walnut every day. Now, it's not as barking as it might sound because walnuts are really full of antioxidants, but they also have a lot of saturated fat in them, which made me slightly suspicious of them, because saturated fat, as I'll go on to tell you in a minute, is perhaps not such a great thing for sperm motility. However, they got a randomised a group. They've got two groups. One had the dietary intervention, which was just to have some extra walnuts per day, and the other group, funnily enough, didn't. So they looked at all kinds of parameters. They looked at the conventional semen parameters. They also looked at DNA abnormalities in the sperm. and they followed this across a 12-week period of time. So we think that spermatogenesis, so creating a sperm cell from start to finish, probably takes about 72 days. So the logic, again, to follow it over 3 months to see if what you're doing in terms of the intervention makes a difference to the outcome and the out result. So they also looked at various other things like their serum and their sperm fatty acid profiles, and they looked at the guy's sex hormones and serum folate levels. And what they found was an overwhelming positive response in terms of sperm motility, but also in terms of some of these other parameters in the walnut group compared to the control group.